Okay, I will start. Have you been down in the dump? Always feeling helpless or hopeless? No matter what you do, you just cannot seem to be happy. Well, if you have ever felt that way, this could be a sign of depression actually. So, I would like to share one story about my friend Akila. Last week, I went out with her for lunch since we have not seen each other in a long time. While we were enjoying our meal, I could feel that she was having a problem because she did not talk too much like before, and I noticed that the size of her body shape was also getting thinner. After that, I asked her whether she had any problem or not. And then she answered me yes. She told me that she was very stressed with her online classes while learning from home because her family does not understand her. And she also has a family problem since her parents have divorced. Hello, Assalamualaikum and good morning, my fellow classmates. My name is Nurul Zulaika BINTI MOHAMAD ROZALI. So today, the topic I will be talking to you is about how to deal with depression. So in this presentation, I will take you on a journey through the major causes of depression and the way how to overcome depression. Okay, first before all of that, I will tell you about what depression is. The website reachout.com states that depression, which is often diagnosed as major depressive disorder, is the feeling of sadness or low mood that lasts longer than 2 weeks and start to get in the way of your everyday life. Next. So, in figure 1, show the global prevalence of depression across the regions and gender in 2017 according to the Global Disease Burden Study. And South Asia ranked second highest among them, which is 27.9 million for male and 35 million for female. Okay, ladies and gentlemen, there are several possible causes of depression. These include genetic or physical injury and medication, drug and alcohol. The main causes may be in our gene actually. The reason I say that is because if someone in that person's family has had depression before, they may carry the same gene as them, which may lead the person having low level of serotonin, which will promote a low level of norepinephrine, which may cause depression. If you have any relative with depression, such as your family, your grandparent, your cousin, you may be more likely to become depressed. Additionally, researchers have found that having a parent and grandparent with depression will double the risk of depression. It's been hypothesized that gene associated with low level of neurotransmitter serotonin, norepinephrine, and dopamine can lead to the development of depression. Besides that, physical injury and mental health are closely linked. A serious injury or chronic illness can cause mental health problems, including depression, anxiety, and post-traumatic stress disorder, which is PTSD. Poor mental health can negatively impact on recovery rate of the physical injury or illness. So commonly, after an injury, a patient's mental health can suffer for a range of reasons. The pain sometimes the pain and time spent in hospital may contribute to depression, or they may suffer from a PTSD from the trauma of the injury. Some people maybe are depressed because they may never fully recover from the injury and their life being altered. For example, that I can give you, a patient may be worried about their short-term or long-term financial situation if they are unable to return to work for some time after the injury. Okay, other than that, depression also can caused by medication, drug and alcohol. Many different medication can have the unfortunate side effect of depression. If we feel depressed after starting a new medicine or medication, I can suggest you should research its side effect or talk to your doctor. There could be a better alternative actually that could give you. And additionally, recreational drug and alcohol use also can cause a worsened depression. While they may initially feel like have symptom of depression, they will make you feel worse eventually. For example, medications such as barbiturate, benzodiazepine, and the acne drug isotretinoin have sometimes been linked with depression, especially in older people like our grandparents, parents. Okay. So I have given you a quite few causes of depression. Now I'm going to tell you how to get your depression treated properly and also way to prevent it. Okay, usually depression can be treated with the help of professional counseling, exercise regularly, and diet. Okay, depression is usually treated successfully with professional counseling and prescribed medication. People with depression can be treated as outpatient or in some cases as a person has to be hospitalized. Psychotherapy or talk therapy is sometimes used alone for the treatment of mild depression. For moderate to severe depression, psychotherapy is more likely to be used in addition to an antidepressant medication. Additionally, cognitive behavioral therapies, which is CBT, has been found to be very effective in treating depression. CBT is a form of therapy focused on the present and problem solving. It also can help a person to recognize distorted thinking and then change their thinking, which can result in an automatic change in feeling and action. Okay, next. For many people, regular exercise can help create positive emotion and improve mood. Usually, people who are depressed may not feel like being active, but I suggest you try get yourself to do it anyway. If you need a push, ask a friend or your cousin, your sibling to do it with you. Getting any activity started help boost our mood actually. So regular exercise or whatever raise your heart rate, it will help you feel more confident, less anxious, and improve various conditions related to depression, such as insomnia. For example, we can take a 15 until 30 minute a brisk walk is enough to flush our tissue with oxygen, release natural feel good chemical, and put our body off toxin. Or you can do some dance, stretch, or do yoga. Okay, last but not least, having a healthy diet. A 2017, I guess, a 2017 study found that the symptom of people with a moderate to severe depression improve when they eat more healthful diet for 12 weeks. The brain is an organ like any others actually, and our overall level of health has a direct influence on our state of mind. Put simply, if we do not supply ourselves with the nutrient our neurons need, we will feel worse than we have to. Depression and diet are likely connected, and many studies have indicated that those who eat unhealthy diet, one that was high in processed meat, chocolate, sweet dessert, fried food, and high-fat dairy product, were more likely to report symptoms of depression. But however, people who consume diet rich in food, which is fruit, vegetable, and fish, are less likely to report being depressed. So in conclusion, we already know what depression is, what causes of the depression, and the way to overcome depression. And I hope that after this, we can help ourselves or someone whom we know is suffering with depression. Many people in the world commit suicide because of depression actually. Maybe with our help, we can save someone or our loved one life. If we feel sad or hopeless, I would urge you to share our feeling and talk with someone you trust. Or talk to your doctor about recommended treatment if fit for you. Tunai serta, depression is a very dangerous disease that can affect our loved one and especially ourselves. So that's all for me. Thank you, everyone.